I'm Louisa Conroy, and I am a family and integrative medicine physician, and I'm at the Griffey Clinic. Getting into integrative medicine really was what I thought medicine should be like from before I even thought about being a doctor. And so, getting into the training, into medical school and into residency, we often are treating conditions that could be treated more gently or could be prevented or treated with lifestyle. And I found in my final year of residency that there was this field that actually concentrates on that, and that is integrative medicine. So luckily I was accepted to a fellowship and was able to do a further training into that so that I can help patients be the most gentle with themselves and empower them to really take care of themselves. I think in this country, we are reactive rather than proactive. And obviously from a financial or medical standpoint, that's not sustainable. So I think that, personal responsibility and, more gentle and lifestyle treatments and prevention is where we have to go, and hopefully we'll be there sooner rather than later. In an integrative appointment, we have more time, and we kind of can spend more time to get to know you, and to know what you're able to do and what you have done, because often in primary care, and it's not that anyone is being neglectful or doesn't have that interest, but it's simply a matter of not having the time to concentrate on what patients can do other than medications. And of course, as allopathic physicians, we're trained in medications. And so that's naturally what we reach for, often as a reflex, and we know how these work. Medications can often be, a second line, after you've tried everything else. And so, oftentimes when I get patients with, for instance, hypertension, and they've never been told that they can control that with diet and lifestyle. And certainly there's always usually a place for medications, or there can be, but that should come after you've done everything that you can, because all medications have side effects. The ideal patient would be someone who has some problems that they've been diagnosed, like hypertension, hyperlipidemia, cardiovascular disease, that they know that there are things out there that they can do, but no one's ever been able to sit down and talk with them. And so they're left to the internet or with varying levels of evidence to help them through that. And as an integrative physician, fellowship trained and board certified, I'm able to help them weed through and give them evidence-based solutions to address those kind of lifestyle problems. And then also even things that are not necessarily medical problems, but you want to idealize your body. So for instance, preconception. There's many things you can do to try to assure the health of the fetus and of the woman prior to even conception. So, kind of a gamut of patients who are just interested in doing more. Anybody is welcome who's interested in integrative medicine. So the way that process actually happens is they would call and let the whoever answers the phone know that they're interested in integrative medicine specifically. And then they will be sent to my assistant, Shelley, who will help get them started and arrange a 10-minute consultation with me that's free to make sure that I can help them with their problem or not problem, just to on lifestyle and being more healthy. And if And if we are a good fit, then we'll arrange for the first visit, which is 90 minutes after filling out a health survey so that we can kind of get to know the patient before they come in. And then we'll work up a plan from there as to what follow-up is needed, if any, and kind of what can be done. And usually, if the recommendations, there might be some given in the first appointment, but usually those will come at the follow-up because it takes some work to get to know what a patient has done or willing to do and what the problems are. For integrative medicine, where we are now with insurance, it's usually seen as preventive or sometimes alternative. So we are, it'll be a self-pay. And so that's taken care of at our office, and insurance is not involved. I think that many of our diseases, our most common killers and our most common illnesses are often lifestyle. So, talking about diabetes, hypertension, cardiovascular disease, even some cancers. And so if you have those, the early stages of those, and you'd like to have a adjunctive therapies with that, those would be great candidates. Or if you have a risk for that, for instance, a family history, and you know that there's more that you could do to prevent, but you'd like some professional help to find out what really would help, that those would be ideal patients who to have some help getting through what they don't have time for in traditional medical appointments. I also have an interest in lifestyle medicine, and then a subspecialty of that, which is plant-based medicine or plant-based diet. If there is anyone who is interested in, what is becoming kind of a popular diet as far as veganism or plant-based, and they'd like to talk about how to do that in a balanced way, and what kind of supplements they might need to go along with that, then I would be very happy to see them, certainly as primary care, or if they're happy with their primary care doctor and would like to see me as an integrative consult, I would welcome those as well.